Well, good morning, everyone, and welcome to the final session of the 2026 UBC ARC Summer School Researcher Spotlight, where we featured two distinguished UBC researchers to share their work in AI. My name is Rachel. I'm a part of the UBC ARC team supporting research engagement and training. We're very glad you could join us today, and we hope that you've been enjoying the program so far. Just a quick note, this session is being recorded and will be uploaded to our YouTube channel after. Before we begin, I'll quickly walk us through today's agenda. We'll start with Dr. Purang Abolmaesumi, who will speak about AI for echocardiography, followed by a Q&A session. After a brief break, we'll hear about Dr. Shwartz on applications of large language models in the legal domain. And we'll wrap up with a final Q&A. We encourage you to stay for both talks. They highlight very different and exciting applications of AI. A few quick housekeeping notes before we get started. Please wait until the Q&A portion to ask questions. And also, as a reminder, to comply with the UBC privacy guidelines, the use of external AI transcription or recording tools is not permitted during the session. We appreciate your cooperation. Before we begin, I'd like to acknowledge that UBC's Vancouver campus is located on the traditional, ancestral, and unceded territory of the Musqueam people. The UBC Okanagan is situated on the lands of the Tsleil Okanagan Nation. We're grateful to live, learn, and work on these lands. It's my pleasure to introduce our first speaker, Dr. Purang Abolmaesumi. Dr. Abolmaesumi is a professor in electrical and computer engineering at UBC and in Canada research chair in biomedical engineering. He received his PhD from UBC and has held faculty appointments at both Queen's University and UBC. Dr. Abolmaesumi's internationally recognized research program investigates advanced topics in medical imaging, machine learning on data at scale, and image-guided diagnosis and interventions. Please join me in welcoming Dr. Abolmaesumi.
Thank you so much, Rachel. I really appreciate it. Let me to my screen. And is this visible to everybody?
Yes, we can see it.
Okay, great. So great to have everybody here. Really appreciate attending this talk and Rachel for organizing this. It's a great honor to be here. And since I guess I understand that most of the attendees are graduate students, I'll keep it fairly low key and look forward more towards, I guess, the question answering that everyone may have. So I'm representing a very broad group of researchers, and kind of this talk is mostly a kind of a journey that we went through over the past decade or so, on point of care imaging for providing access to healthcare to various remote regions in British Columbia. So the talk today kind of anchors around a story I guess I wrote in this book during the pandemic, Chromatic, where I worked with a lot of colleagues from many different departments, from philosophy to English to law to neuroscience. And we worked with artists to kind of visualize the kind of what an equitable healthcare may look like in British Columbia. And these birds kind of represent the patients, the decision makers, the healthcare workers, and kind of to kind of create a kind of a collective that would benefit everybody. This talk obviously comes from the work of many collaborators and students over the years, and many of whom I guess are not graduated, but these folks I guess have been working with me for the past almost 2 decades to make this work happen. And also I wanted to acknowledge all of the funding agencies that have helped us over many years to get to where we are today. So for today's talk, I gave the talk to Notebook LM, and gave it a very specific prompt. And I get to this later, but kind of the reason kind of I'm trying to highlight this is that basically the kind of this is kind of the structure of the talk. And if you give these AI engines a very, very detailed prompt, they can actually give you a very nice kind of um, representation, I guess, of the data and the slides, I guess, that you will see today. And the the talk, though, mostly focuses on cardiac imaging. So, what is cardiac imaging? Basically, we have in medical imaging, imaging the heart is obviously very challenging. It's a dynamic anatomy that is continuously changing, I guess, in shape. But at the same time, it's a very critical anatomy for which we need to look at the structure, the function, to understand, if somebody may have any cardiac disease. There are many modalities in observing the heart externally. The one that I will be talking about primarily is ultrasound, because it's really normally the first point of contact with the patient for looking at the anatomy. Um, the beauty of ultrasound is that since kind of the advent of the smartphones in 2000s, a number of companies now have come up with various solutions that are miniaturizing this technology. So today you can buy these devices from many manufacturers, and they use basically your phone as a display, and they provide you with real-time imaging of the heart. So you can think about this as a very fancy stethoscope. And in fact, I mean, the stethoscope technology has been around for about 200 years. This is really kind of a big revolution since then in actually being used for monitoring the anatomy anywhere really in the body. So how this links to my talk today is that in 2013, I had a random call from Dr. Teresa Sang, the director of echocardiography in Vancouver, who had found my name because I did my PhD back in 2000 at UBC on robotic ultrasound. And her challenge was that they have these fancy ultrasound devices, $200,000-$300,000 systems on the left that they use these on a daily basis to scan patients in their echocardiography lab at VGH. But then they were seeing more and more clinicians in other departments in the hospital, for example, emergency departments. They're buying these cheaper portable, I guess, point of care devices that they're carrying them in their pocket as a stethoscope and getting images. But the problem was that because these physicians were less experienced than a cardiologist, um, they basically were acquiring an image and then sending her a note saying that, could you please tell me if the patient has a cardiac disease? And obviously, because Dr. Sang did not trust, I guess, the acquisition of those folks because they weren't experts. They had to bring the patients to cardiology, and that was causing a problem. It was causing a big bottleneck in patient care. And the reason she looked for me was that she was looking for an engineer who could design a robot that she would be sitting remotely in her office, controlling it to scan the patient in any of the rooms in the hospital. So because I had gone through this journey kind of in my PhD, I basically told her, look, I don't think robotics is scalable. Obviously, it's a great technology, but if you want to use it everywhere in the hospital remotely, it's really not the best solution. And that was around the time that the first waves of the deep learning papers were coming out. So kind of, I suggested, you know what, let's work together, get our hands on the data that are already archived at the PAC system at Vancouver General, and see whether we can build AI solutions for this. So the very first thing we tackled was the acquisition. And you can imagine within the acquisition problem on the left, you are taking the transducer and moving it on the chest across many standard views of the heart. So these are kind of any position of this transducer is associated with a kind of what the textbook anatomical view of the heart may look like from many different orientations or cross sections. And clinicians, expert clinicians know what these are, and they can place, they have a very good hand-eye coordination to move from one imaging plate to another. And I consider this more like a driving problem. You know, you go from point A to point B, and you use your Google map for making that navigation. But then when you get close to the destination, what you want is to park the car, for example. And then the sensors that you use and the technology that you use to park is slightly different from the GPS itself. And this is really where our research started. We decided that, you know what, we can assume that users roughly know how to place the transducer, and then what their problem is more of the parking problem. So this basically became an AI problem for us. So we designed a neural network with the labels that the physicians provided for best, positioning the transducer, and created a solution that would, for example, give you the right cross section of the anatomy versus an oblique, for example, cross section, because these oblique cross sections can give you a wrong perception of what the anatomy, for example, volume may look like. So this is kind of a sketch I came up with at the time, what we call the traffic light technology. And we integrated it inside Android phones at the time. So and then so in this video, you see that the kind of a TensorFlow light model is running in the back, detects what the view is from the standard ultrasound acquisitions, and then also the quality of that associated with the parking problem. So we used basically the duct tape technology. We stuck them to the side of the monitor on the top left and used the frame grabber to get this data, and ran a number of clinical studies, kind of to see on the user side how much impact this kind of guidance in a kind of parking would help the users. This was kind of maturing around the same time that the Trudeau's government gave about $300 million plus to BC for the digital technology supercluster. And we basically presented a case to the board to say, look, we can integrate this AI technology inside these point of care devices, especially by a manufacturer called Clarius, which is in Burnaby, BC, with whom we have been working for years. And we can then deploy this across the rural communities in British Columbia. So the board approved the project. It was, I think, a $2 million investment. And then, so the project started January 2020, and then COVID happened in March 2020. So then they came back to us, and this was a project that was supposed to take 2 years to complete. They came back to us with another $500,000 and suggested that we actually accelerate the deployment to 6 months and expand the use case to not only cover echocardiography, but also obstetrics and also lung imaging, because it was relevant to detecting COVID. So it was actually very fun to work with our grad students. and the company and the healthcare providers and Rural Coordination Center of BC to actually put this network together in a very short period of time. So today, this network has almost 100 transducers across BC. All of them are interconnected through a cloud infrastructure. And there a subsequent study by the School of Population Health at UBC actually showed that the presence of these devices in the community are significantly increasing the confidence of diagnosis in rural areas. So a few years back, actually, St. Paul's Hospital downtown actually used this as a success story for additional fundraising for the hospital foundation. But for me, kind of as a biomedical engineer, one of the key things that was very relevant and I thought it was most impactful and meaningful was the stories we received from the community. For example, this one, I believe it was from Dr. Kask. I think it was in Campbell River, and it was about kind of a mother who was pregnant, and just the pure presence of these devices in the community kind of helped her agree to engage, for example, in continuing the pregnancy. And there were many, many of these stories. But then as the I kind of we were feeling, okay, so this is great. We're deploying this in the community. As an engineer, I was basically also getting very worried in some way because we have devices that can run AI technology, and we all know that they have limitations, these AI technologies, and without any safeguard and checks and balances in place, they can actually lead to harm. And there has been a number of stories in the AI community in um, wrong or unguarded kind of deployment of these technologies. The most pronounced version of that was in mammography, which the technology that actually deployed with FDA approval in late 90s actually led to harm with subsequent studies that came 2 decades after. So the real question we were asking was that, are we ready? Are we kind of deploying these technologies too fast, too early? And are we going to cause harm? So this is kind of for this talk, I asked ChatGPT to kind of give me images of what it thinks cardiac imaging looks like. So if you look at, the prompt, just give me a sonographer, acquire echo data, you'll see immediately, the images look very realistic. But unless your heart is on your right-hand side of your chest or in your neck, there is no correlation between the placement of the transducer and what is on the screen in these devices. This actually is not unique to ChatGPT. In fact, Gemini and Grok, for example, have similar issues. And the point I'm trying to raise is that these models are really some of the most powerful models that we know today, which have been trained on almost the entire internet, but they still do not have a great understanding of the anatomy, physics. They can just give you pretty images. And the real question really is that how do we use technologies like this in regulated environments that have actually real life consequences within our community? So there have been a number of papers, especially over the past year, that have been published from companies and a number of groups globally that are demonstrating that, okay, that we can also build very large kind of foundation models for echocardiography. Um, and also, there are a number of commercial products. I mean, most of the echocardiography machines today have some form of an AI integrated in them. And there's also a lot of point of care solutions from many players globally that are FDA approved and or CE approved, and they are being deployed in the clinic. The core of our research, though, has been that how do we build a technology that is trustworthy? And trustworthy, this is a kind of from a paper from 2021. It has many different attributes. And within this talk, I'm going to focus more on the explainability part of this diagram, but there are many different aspects that also cover what we call trustworthy, and this is specifically critical for healthcare AI, because if a physician cannot trust it, they will not use it. I also encourage many of the students on the call to actually go and look at these guidelines. A few years ago, I worked with a global team of about 80 researchers. I was, I think, the only Canadian initially, and then there was another colleague also added from Toronto, that we worked kind of to come up with these guidelines to actually kind of encourage everybody when they're designing healthcare AI systems to look at different requirements that these solutions should have. I think that for kind of your own research, it's actually very important that you're aware of at least such opinions that may help you navigate how you kind of move your research forward in this field. For the purpose of the talk, I'll focus on one project that we have. It's funded by CIHR project grants, focus on heart failure. And heart failure impacts, 1 in 4 people worldwide. It has a very high mortality rate, and it's a very challenging, I guess, disease that to be diagnosed reliably in point of care. So when a patient has symptoms of heart failure, which could be, shortness of breath or fatigue, they normally go to emergency room. And then the question is, do they have heart failure? And if they have heart failure, what's the original cause of this? And this can be related to many different, I guess, aspects of the anatomy and function. But the two key ones are related to the myocardial disease, which is kind of the muscular kind of dysfunction of the heart, or valves that are inside the heart. And depending on what type it is, actually there are different types of intervention and treatment recommendations for these. So uh, uh, I'd like to kind of highlight kind of one pathway that we are going forward for building a holistic solution for this. We call EchoAgent, and EchoAgent as a whole is a large language model that is orchestrating a number of tools. But the key thing here is that these tools are all managed by focus on clinical guidelines, because in medicine, in contrast to kind of unregulated industries, one really need to focus and emphasize the interpretability within the context of clinical guidelines for the technology to be used by the end user. Within this kind of agentic design, there are many kind of, I guess, common components that one needs to look at. For example, cardiac cycle is a very cyclic process. So one need to understand where in the cardiac phase, and depending on where the muscle contractility or the valve motion, for example, are to be able to understand kind of different kind of observations from the heart. And for that, we focused on some of the computer vision literature. This were originally started by Google in kind of coming up with an embedding space that kind of encapsulates, let's say, similar motions in different videos that are on the same task. But one thing again unique about cardiac is that it's a very kind of in some ways sinusoidal movement. So we can actually take advantage of this and redesign those frameworks from the computer vision community to capture different phases of the cardiac cycle. So um, we did that, and kind of today we have tools that can automatically take any kind of video of different views of the heart, and independent of which view it actually maps it to this embedding space that is kind of harmonized, and all the videos kind of capture the same cardiac phase. Then we can take advantage of these in downstream tasks. For example, one of the key challenges in point of care imaging is to be able to segment, for example, in this case, the myocardium, which is the muscle around the left ventricle, um, in different image quality variations. People with, for example, high BMI may be very difficult to image, and therefore their images are less, I guess, sharp. But you need to be able to robustly make these segmentations and measurements so that when combining with the phase detection, for example, you can make a measurement called a strain. This is basically a measure of how different parts of this myocardium are actually contracting and expanding, and then you can map this to this what they call a bullseye diagram that shows you in the left ventricle how different parts of the muscle are moving, and that allows you to actually come up with an indication of, for example, myocardial disease. Um, in addition, there are a number of linear measurements that are done based on the clinical guidelines in different cardiac views. So this was a work that we published using graph neural networks a few years ago, for example, for measuring some of these measurements in a cardiac cycle. Another challenge, I guess, that you normally face in this data is or that there's a lot of auto distribution data, and if you don't account for that, you can make measurements that are wrong. So the question really in this work was, how do I know when I don't know? And this is actually not an easy problem to tackle in an AI engine. In fact, if you ask ChatGPT almost any question, it gives you an answer. It never almost tells you, I don't know the answer. And this is really a problem because this can lead to hallucination. And I'm sure Vered will talk about some of these in her talk after. But basically, we kind of had to come up with ways to quantify uncertainty and out of distribution of the data so that we can actually do not we do not measure anything from those samples. Um, One of the key parts of heart failure, as I mentioned, is valve disease. And in this series of slides that I'll present is one of the valve diseases called the aortic stenosis. So aortic stenosis kind of always happens to all of us over time. There is calcification on the valves. And then this calcification means that your valve doesn't open as much. So it's a very constricted opening. And that would mean that the blood flow from the different chambers of the heart gets restricted. And that actually can lead to this fairly rapidly. So the severe cases of this, they only have 2 to 5 years to live. So in an echocardiography clinic, what they do is that it's the pathway at the top. So if you see an expert at VGH, what they do is that they use their fancy $200,000-$300,000 machine. They measure the Doppler, which is around the valve, which is basically an indication of the blood flow velocity across the valve, and they compute the kind of the volume, the stroke volume that is passing through the valve, and that allows you to kind of get an indication of what the whether there is valve disease and how severe it is. The problem with Doppler imaging is that you need to be an expert in acquiring this data. So if you are less experienced, if you're not a cardiologist, or you don't have access to those fancy machines, then you can't really get these data. And therefore, the question in this case, which is funded by another CIHR project grant, was how do we make this assessment without the use of Doppler and a point of care device, which is generally lower quality. So for this to happen, we went back to computer vision literature. There are a number of kind of papers on prototype-based technology, and within this field, we kind of redesigned kind of the framework of classifying and detecting aortic stenosis using a video-based prototyping solution. So the way this works is that you kind of have a neural network that is also learning where to focus in the image, because you don't have a label of exactly where the valve is in the video. So there is basically a cropping engine that is paying the attention to the valve. And then this creates an embedding for you that then you can use to make a classification. But the way the prototypes work is that you kind of learn the association of those embeddings to examples of those embeddings from your training data. And the beauty of this is that this is a very grounded approach, because you have your training data with expert labels. And then the question is, for example, this cropped region on the left is similar to which one of these cropped regions on the right from your training. One other challenge, I guess, that you face is that, again, as I mentioned, there is a lot of out-of-distribution data. So how do you also learn that this region, for example, that you see on the left is very poor quality, for example, and the valve is not visible? So you don't want to make a wrong association. So we also use some machine learning tricks to also learn an uncertain class automatically. And with that, kind of now you kind of have a new case. You can actually associate it to different classes, get a scorecard, and from there kind of come up with an assessment. But you can also always trace back the classification to your training data set. Now, this was done using Euclidean geometry. So we hypothesized that maybe another framework, such as hyperbolic geometry, where data are naturally across different scales, can actually better capture this prototype space. So, and the reason is that aortic stenosis is related to, obviously, to both the valve itself because of calcification, as I mentioned. So it could be very local, but at the same time, the restricted valve motion also impacts the broader tissue motion around the valve. So you can also have impact on the other pixels surrounding the valve that you could use and take advantage of. But obviously, these two are not at the same scale. So what we did was we went through from the Euclidean, we mapped it to the hyperbolic space, and this resulted in an embedding space that is naturally hierarchical. And in fact, you can see in the HORO-PCA space, if you look at this hyperboloid from the top, there are different kind of grades of the disease. For example, significant disease or early stage disease or normal disease, they're kind of mapped in different directions of the hyperboloid. And you can take advantage of this geometry to kind of perform a better classification, which I'll just show you right now shortly. We also did another work, also aligned kind of images with text reports that we had from these echocardiography data. And we showed that collectively you can actually learn prototypes that not only are image-based, but they are also encapsulating part of the echo report text. So again, the decision-making grounded in text. So when you put it all together, on the very right is a commercial product that's currently FDA approved based on some of the work that was done at Tufts University. And then the ones we call image-based, they are all kind of looking at kind of a valve image. And obviously, because they don't have captured the dynamic of the echo data, they're kind of lower performing. Then the Ginsberg is the work that we first did with black box methods with no prototypes and explainability in mind. And then as you go towards left, you kind of build two bars explainability. And that to me is actually a very critical message, that you don't have to sacrifice accuracy when you go towards explainable kind of methodologies. In fact, you gain accuracy in this context. One other thing we recently did, for example, was that we used the same approach for solving one of the very interesting clinical problems, which is the left ventricle filling pressure, which is another key indicator of heart failure. And we used this approach to actually come up with a prototype space. In this case, there are two parameters from the Doppler data that are very critical for measuring the filling pressure. And we actually showed that these prototype spaces, without the use of the Doppler data, can actually learn this space very regularly. And in fact, again, Ackerman is another commercial product on the right-hand side that is currently FDA CE approved. And we can actually outperform that using our prototype-based solution. So the all today was basically processing one video data at a time. So then obviously an echocardiography study may have up to 100 videos at a time. And then the question is, how do you go to the full study analysis? So one way to do it, for example, is to decompose your decision-making process to different phases in an agentic design. And you can, when you put it all together, now you have kind of this multi-layer agentic solution, which there is a core, which sub-agent that is performing a single video-based analysis. And then there is a broader agent that is aggregating the data across many different videos, along with the memory of knowing what happened in the previous decision-making step to make a final answer. So this video kind of shows you where we are at right now. So we have a kind of an agentic solution. You can ask a question from it. On the left side, you will see some of the standard echocardiography views. And then you can, when you ask a question, it goes to the guidelines. It extracts kind of information related to the question. Figures out, for example, in this case, that it has to identify in diastolic and systolic phases. It makes the measurements from those and aggregates the data using the formulation in the guidelines to answer a question. And in this case, there are three different videos that are all looking at the heart from the same standard plane, but slightly different perspectives. And it aggregates the information and comes up with an answer by looking at the data together. So it synthesizes, for example, and gives you an answer based on the guidelines. So more recently, we were fortunate to be funded by Genome Canada and Genome BC for a project that's called Mosaic. So now we have these point-of-care devices across the entire community of BC, all health authorities, and we are seeking volunteer patients who are willing to be scanned both with echocardiography and also genome sequencing. And what we're trying to do is that in many of the communities, especially the First Nation communities, certain cardiac disease are very prominent, and there is very likely a genetic kind of reason for this. So what we're trying to do is further align our imaging and analysis with also genomic information. And then also we have a project with the Ministry of Health currently, getting access to Health Data Platform BC, which then allows us to further expand this analysis longitudinally for the entire life of a patient, including any touch points they've had with the healthcare system, so that we can predict health trajectories of individuals across British Columbia and then hopefully inform clinical decision making much earlier than what is possible today. So with that, kind of I end the talk with this slide, going back to the first kind of diagram that I said I gave you. I gave the talk to Notebook LM. This time I didn't give it a prompt. I just said summarize the talk for me. And you can see without a specific prompt, it actually came up with a very nice, fancy visualization of the talk, but they actually focus on completely different things in the talk than what originally was my intention in terms of the structure of the talk. The reason I'm bringing this up is that this is a problem actually that healthcare practitioners are faced every day. Any patient walks through the office of a GP or somebody in the hospital, the physician needs to look at the entire history of this patient, every touch point they've had with the healthcare system, identify the key, I guess, pieces of information that are most relevant to that visit on that day of the patient, and then suggest a diagnostic or treatment pathway for that patient on that day. And it's a very, very difficult problem. You can imagine in our lifetime, we have many, many touch points with the healthcare system. And how do you not miss information? How do you aggregate those data is actually a big clinical and AI problem. And this is really where we are kind of moving towards at the moment as we scale up towards kind of provincial scale data analytics. So with that, I end my talk and happy to take questions.
Thank you, Dr. Abolmaesumi, for the insightful talk. We'll now move to the Q&A portion. We have about 12 minutes for questions. Feel free to submit your questions using the Q&A or the chat feature. You can also raise your hands and we'll unmute you so you can ask your question directly.
It's a very quiet group.
So there's a question in the Q&A from Jessica. The point of care device looks fantastic, especially in terms of geographical accessibility in healthcare. And thank you for bringing up the concept trustworthiness of AI in healthcare. I'm curious about how quality assurance of outputs is being conducted to ensure the model continues to act as expected. Where in the process does human in the loop occur?
Yeah, this is a very hard problem. It's actually not that straightforward. So the challenge basically with the AI today is that it cannot guarantee that its output is correct. I mean, our team basically is working, trying to work with some of the top experts in AI, such as Vered on the call, to actually figure out pathways on how to design these systems that their likelihood of causing harm is very low. One of the ways that we're trying to do it is based on this explainability pathway, so that at any point that is a diagnosis or a treatment is recommended to the physician, everything is grounded and shown to the physician that, for example, I am making this a specific recommendation because this patient, for example, had a CT 2 months ago and there was this specific, for example, nodule inside the CT, and they had a blood test, and there was this biomarker in the blood test. And the physician then can go and verify all of this. So at the end of the day, the responsibility is on the physician to understand kind of the clinical guidelines, the patient history, and integrate all of those data. But kind of our really approach is to make it as seamless as possible, so that while not overwhelming the patient with too much the physician with too much information, we actually provide them with key parts of information in the limited time that they have interacting with the patient.
We also have a question from Sandir. Sandir, your mic has been enabled, so feel free to unmute yourself.
Okay, I also started. First of all, thank you. We are addressing some of the same questions in the head and neck surgery domain. I worked with Vered before a little bit, and so quite familiar with outstanding what goes on there. So I would call this some rapid fire questions in some very deep technical. And so I'll go with this saying, whose agentic framework and whether you're using MCP, multimodal sensor fusion, audio and video together, single class versus multi-class from the same image, one model doing one class at a time versus multiple classes being detected at the same shot. Passing videos to agents can really blow up the context and the token usage and whether that can be done. And then the HIPAA-related constructs around passing data to LLMs, clearly going to the LLM in the cloud, and how you anonymize and doing that. And so those don't want to take up too much time. You have done fantastic job. And if you cross some of these boundaries, would like to get some guidance.
Okay. So first of all, maybe I'll put a link to the paper that we will be presenting in 3 weeks in Japan. And this is kind of the design of the system, so you can actually read more about the details of it. So many of the things that you are asking are related to commercial deployment of these systems. Because of exactly the same thing that you mentioned in terms of the privacy issues related to this data, we actually do not use any commercial cloud system for this. What we have done is we have written the entire agentic system using open source models, fine-tuned on our data, and we run it at UBC within Arc. Basically, this allows us to have full control on the data flow and access to the data. So we are kind of redesigning now our workflow, for example, to use MCP and other technologies. But yeah, so many of those, I guess, will come very relevant once these models are being used by the physicians remotely from at VGH. But at this point in time, we do not have a plan to deploy this commercially nor place it in a commercial cloud. So everything would be within the UBC kind of environment.
And then getting to the technical part about blowing up the context, even with the private network, with videos being put into the agent memories, that being used as tool. And also as you go towards multimodal audio and video fusion, have you crossed those paths and, what's the experience there?
Yeah, so we don't have audio at the moment, but obviously the context memory, yeah, I mean, there are many different ways of organizing that context memory. So the current way currently is that basically we just remember what has been done, because the number of steps that are normally in these clinical decision makers are not too many. So we don't really need to lead to, for example, I don't know, fine tuning, for example, an LLM based on the context memory to kind of compress it. But we may get there as we go towards provincial level data analytics. For those, we have to work with experts on campus, including Vered, to make it happen.
Thank you.
Yeah. Any other question? Guess there are no questions, Rachel.
Yeah. Thank you. So if there's no other questions, I guess we'll close this part of the session. Thank you again, Dr. Abolmaesumi, for that excellent presentation. We'll now take a short 10-minute break and we'll resume back at 11. Please don't go too far. We'll continue with our second speaker when we return. Thank you. Okay, welcome everybody. We'll get started again in just a moment as people rejoining. We'll now continue with the second half of our session. Next, we have Dr. Vera Shwartz, who will speak about application of large language models within the legal domain, followed by a Q&A. It's my pleasure to introduce our second speaker, Dr. Vera Shwartz. Dr. Shwartz is an assistant professor of computer science at UBC and the CFAR AI chair at the Vector Institute. Her research focuses on natural language processing with the emphasis on developing models with deeper human-like language understanding, as well as responsible AI applications in a sensitive domain such as law and medicine. Please join me in welcoming Dr. Shwartz. Thank you.
Thanks, Rachel. And hi, everyone. Let me just quickly share my screen. Okay, I think you should be able to see the slides now.
Yes, we can see.
Okay, perfect. Okay, so I think my talk will be very much complementary to Purang's talk because it's another domain where that AI can highly benefit, but also where errors can be really costly and we need to be very careful and responsible when using AI. So yeah, I'm going to talk about AI for legal applications. And the main takeaway from this talk is going to be that AI can democratize legal access, but also makes it impossible to know what's true. So I'm going to start with an example. So I want to show that, well, as you probably know, LLMs are increasingly used in legal settings. And they are used both by legal experts to streamline their legal research, make it more efficient, but also by lay people, non-experts, because it can help them access information. It also makes the law more accessible. In this example, I used ChatGPT and I asked it to find me precedents for judges allowing a divorced parent to take their children on a trip abroad. And it quickly came up with precedents from various countries, including a nice summary at the bottom of the bottom line. Could be very useful for someone looking for this. Now, I chose this example because this is the example that was used a couple of years ago by a lawyer in Vancouver to find precedents to bring to the court for a court case that was discussing. She was representing a client that was a divorced father that wanted to take the kids for a trip abroad. And she found these two really compelling precedents, but unfortunately, they were both completely hallucinated and made up. And this is one example out of many. I'm sure you've heard about a few others. There's this website okay, before I describe the website, this problem is called hallucination. So obviously LLMs are very useful in providing us information about a range of topics, but occasionally they hallucinate, that is, generate content that is factually incorrect or unsupported by the source information. So in this case, the source information could be the collection of precedents or court cases, or sometimes if you ask a more generic question, then the source of answer would be the web. And hallucinations are very common, and currently we don't really have a technical solutions for preventing them. There's some ways to mitigate them, but not a way to completely prevent them. And it's especially problematic when deploying LLM-based tools in high-stakes domains such as law. This database records cases from around the world where a court found that a party relied on hallucinated content or material. So this is just a subset of hallucinations in the legal domain. This is just when this actually somehow disrupted a court case and was discovered. And there's about 1,400 of these documented so far. A couple of years ago, we collaborated with Air Passenger Rights. You may have seen them on the news. not about our work, just in general, the air passenger rights. It is a nonprofit organization that helps Canadian air passengers understand and exercise their legal rights when they face issues related to air travel, so flight delays, cancellations, baggage loss, baggage delays, and so on. So they have a website with all the information for what you should do in these cases. And they also have a Facebook page that when people face these issues, they go on the page and ask questions. And they have this like the volunteers that help answer the questions. And so a few years ago, they reached out to us and asked us to build them a chatbot that can answer questions from passengers and alleviate some of the workload that the volunteers face. But they had that one condition, which is no hallucinations, which I agreed with, generally speaking, because you don't want to generate false legal advice. But hallucinations are inherent to the process in which LLMs generate text. And I will go back to this in a bit. So the best that we could come up with under the strict no hallucination condition was some sort of semantic search. So what we do is you have a user phrasing the question in natural language. Like, for example, I need help with a canceled flight and damaged luggage. Can I get on another flight without paying more? And what should I do about the luggage? So we use an LLM to break down the query into simpler self-contained queries. So that would be what are the policies for getting on another flight after a flight cancellation, and then a separate question about what steps should be taken when luggage is damaged during a flight. These happened in the same trip on the same trip, but they are two different questions. And they are self-contained, so we have the model decontextualize them, so like make sure that they don't depend on the context of the entire query. And then we use these two queries these multiple queries to retrieve the relevant documents from the air passenger rights website. And we stop there. We don't generate anything. We just display the snippet from the document, the relevant snippet from each document with a link to the full document. And then the user can go and read the document on their own. So if you are familiar with retrieval augmented generation or RAG, this is basically just the R in RAG. So we're just doing dense retrieval with some query preprocessing with an LLM. So the results in this case are zero hallucinations by design because we don't generate any text. So like the worst that can happen is that we give them a document that's irrelevant for them, but it's not going to give them, I think by design cannot give them false advice. And when we compare this to full RAG pipeline with the same, pretty much the same, just like allowing the model based on the snippets that we retrieve and the document to generate the answer, we manually analyzed that later, and we had almost like 28% hallucination rates. So that's very high. And we also did a user study, and we showed that when you have users answer two different questions, one with our tool and the other one just with a simple Google search. So this was before the AI overview, so there's no generated answer, just like a standard traditional Google search. They preferred our chatbot. It was more convenient to get information that way. But obviously, this is less helpful than conversational AI, which gives the users an answer that is specific to their scenario and doesn't require them, like in our case, to go and read legal documents. So overall, this solution is pretty limited, and it's not as good as making the law accessible for non-experts. And as a side note, actually, none of the work that I'm going to discuss today has been deployed yet. Things move really slowly in this domain. And often the barrier in actually deploying something is that we don't actually have data for this specific application to do more like a larger scale evaluation. But even though it's been a while now, I'm not giving up on that. We're going to continue working on it. So yeah, as I mentioned today, people do expect conversational AI and like an answer that is generated and tailored for their specific question. They do get that when they do a Google search now in the Gemini AI overview. And there are actually LLM-based legal tools that are specifically designed for legal queries. This is one example. This is Casey from Caseway AI, which is a Vancouver-based startup. So rather than me just saying, okay, no, I don't think we should, and we should solve the hallucination problem first before we have like models generate legal answers. Obviously, that ship has sailed. So we're now interested in reducing hallucinations in such tools. So we recently teamed up with Caseway, that company that I mentioned. We got some funding from NSERC and Mindex to work with them. And we also teamed up with collaborators from the Allard Law School as our legal experts. And our goal is to evaluate and improve the accuracy of legal research tools. So the first thing that we realized is that there aren't actually benchmarks that test the common ways that people use them here. So for Canadian law, usually for example, a Casey example that I showed, it works against a collection of Canadian case laws, like existing court cases. And there aren't any benchmarks to actually test that specifically. And so when we started working with Casey, we realized we don't actually have some like number on the accuracy of the tool or like the hallucination rate. And so we started with building a benchmark for RAG systems that use Canadian case laws. And so we created this benchmark semi-automatically, but with experts in the process. So we start with a large database that we have of existing court cases, case laws. These are publicly available. And we sample, so to generate the query, we first sample a case law. Then we also sample a personality because we want to vary the types of users that ask the questions to simulate a more realistic usage of legal research tools. Then we provide this to an LLM. Specifically, we use Gemini and ask it to generate a seed query from the user with that persona that could be answered by this specific document. So, for example, it can generate something like, what are my rights if my landlord enters my apartment without notice? Then we again provide this to Gemini and ask it to generate different variations. So, for example, there's a bunch of different variations. You can see that in the paper. It's on arXiv. But for example, we sometimes like change the point of view. So maybe instead of asking from the tenant's perspective, we want to ask from the landlord's perspective. Or we change the focus of the requested or required information. So are we asking about like the next steps, or are we like trying to interpret the law and so on? And this also includes whether it's coming from a layperson or a legal expert, like a lawyer or paralegal. So the language is also different. This is just like a sanity check because our human annotation was really expensive. We wanted to first run this by an LLM as a judge, just to like remove queries that were nonsensical or were not answered by the case law. And once we have the remaining queries, we provided them to legal experts. So we recruited law students from Allard and one or two paralegals that work in Canada. And we had them basically do the entire like legal research as they would do it normally. So you have this query, and now you have to give us an answer. You need to provide an answer, and they go through that process of finding the relevant case laws as they would find them normally. So we allow them to use the existing tools that they usually use, like Westlaw and Canly. And then they have to eventually write an answer based on these case laws. So overall, we collected about 500 queries and along with their answers, and they're attached to, it's overall around 600 unique case laws, but in terms of pairs of queries and case laws, it's over 3,000. It's because a lot of our queries, they remain on the same topic because of the variations that we created, but we do test for like whether the answer changes according to these variations. As a side note, these things are actually working with experts is obviously like needed here. It does make it very much slower and more expensive than it is than like in previous data sets that we collected with like crowdsourcing workers. But it was an interesting experience. Then we tested a bunch of open source proprietary and legal models on our benchmark. So at this point, we're just benchmarking, existing tools, not any like proprietary legal research tools yet. So we used QN and Gemma as the open source models, Gemini is the proprietary model, and Canon 2 is legal embedding. And we use a RAG setup. So we first retrieve documents from our document collection, which contains the case laws. And then we provide the retrieved passages to the LLM, and the LLM generates a response. And we had various different types of retrieval. So we have dense retrieval, which is the standard in RAG, which is you embed all the case on all the chunks in the database, and then you embed the query and you find the most relevant ones. But we also use the more traditional sparse retrieval based on BM25, hybrid approach between the two, and then a bunch of like retrieval enhancements like iterative retrieval, where the model first tries to answer the question and based on the language of the answer tries to retrieve relevant documents, and re-ranking. And in terms of evaluation metrics, we had a bunch of these as well. So we test the retrieval and the generation separately. So for retrieval, we just use, for automatic metrics, we use standard metrics like recall at K, like the top K retrieved documents, how many were covered from the gold standard documents, and MRR and NDCG, which also look at the precision and the ranking of the retrieved documents. And we also had a manual expert evaluation for the relevance of documents. And in terms of the generation, we looked at the accuracy of the generated answer as compared to the expert answer. And we also looked at how grounded it is in the retrieved documents. So you can think about it as the inverse of hallucination rate. So if there are any claims in the answer that are not covered by the documents that were retrieved by the system, then these might be hallucinations. And we also did a lot of analysis in the paper. I'm not covering everything here. So again, if you're interested, you can check the archive paper. So in terms of the findings, the main findings, so first of all, we did see that the generated answers, they diverged from the expert written answers pretty often. And there's different reasons for that. So first of all, part of that is due to basing their answers on different documents than the experts did, because we have a pipeline system where the system first retrieves documents and then generates the answer based on the documents. So trivially, if it retrieved different documents from what the experts did, then the answer would also be different. And you can think about this also in a way happens between like maybe different lawyers. Sometimes deliberately, if a lawyer represents a client and wants to reach a certain conclusion, they're going to base their answer on the case laws that support their conclusion. So that might look different than another lawyer's answer, even though both are essentially correct. I'm not trying to claim that the models did anything deliberate here, but just a trivial observation that if the retrieved documents are different, then the answer would be different. And it's not necessarily indicating that the answer is incorrect, because when we had experts judge the relevance of the retrieved documents, some of the documents that were retrieved by the system were considered relevant by the experts, although the experts that initially did the legal research didn't include them, because there are a lot of cases where there are many case laws that would be relevant. So that's one thing. The other thing is on average, the answers that were produced by the systems were a lot longer than the answers from the experts. I guess that's not surprising to anyone that uses LLMs. They're very verbose. And so again, this would be trivial. Like if you have more information in the generated answer, then a lot of it would just not be covered by the expert answer. But then just to analyze that and see how much of this is because these claims in the generated answers are wrong, we did manual evaluation of a subset of these unsupported claims. So we found that many of them were simply more detailed than the experts thought that required. Many of them were irrelevant to the query, not in terms of like, on a different topic, but just in terms of it's on the same topic, but it's not helpful to include that information. Sometimes even like completely missing the point of the query, actually in a lot of cases. And around 8 of them were completely hallucinated. And I determined that, we determined that by going into the documents that they were citing and seeing whether the documents were supporting claims that they were citing. So that's still like non-negligible percent. And then the last thing we also looked at is, okay, maybe the answers diverge, but if we look at an answer and the retrieved documents, and completely just ignoring at this point whether the documents were relevant or not, we just want to know whether the answer is supported by the documents. And because if it's not, then that could lead to, could indicate hallucinations. And so we again analyzed a subset of the claims that were not supported by the documents that were retrieved by the system. And again, we found that many of them, almost 40% of them, were just due to the length of the answer. So this would be, connecting sentences or conversational sentences that the experts didn't have in their answers. But these are valid, so these are not, the system should not be penalized for that. But then the rest includes all kinds of errors that are kind of between reasoning errors and hallucinations. So confusing legal entities, misapplying the law, emphasizing minority opinion over the authoritative law, and more. So the bottom line here is that it's hard to give a number for hallucinations here, but it's definitely still a problem. Then another thing that we saw was that the models did better on queries from legal experts than queries from lay people, or simulating legal experts rather than lay people. And again, that's not very surprising because the query language in the case of legal experts is more similar to the language in the documents because they know the terminology, they know what they're looking for, as opposed to like when someone is asking a legal question, like some layperson is asking a legal question, then they're not necessarily using the same language. But then we also saw that this gap is reduced with retrieval and enhancement. So specifically iterative retrieval, that's where the LLM first tries to generate the answer, and then based on the generated answer, it tries to find the documents and again generate the answer. So what it did was effectively translating the query to legalese, which helped. So that was interesting. And we also looked at the performance across different provinces. We don't have an equal distribution of provinces in our data set, but from those that were covered, we saw, interestingly, BC had the worst performance typically. I don't know why. Something that we can look at a later point. And then the last main finding here is that evaluation is really hard. So automatic evaluation is very limited because like the retrieval evaluation penalizes systems for retrieving documents that are relevant but were not included by the experts. And then the generation evaluation penalizes systems for generating long answers, or also from drawing inferences that are not directly available in one retrieved document. So, and that's something we want them to do. We want them to be able to synthesize that information from multiple documents, but right now we don't have a way to check if they did this correctly or not. And expert evaluation is really costly, but it is necessary. And another interesting point that we ended up not including in the paper, but I think this is definitely something we want to look at for future works, and it's a little bit hard to quantify it, but we were surprised to learn how long it was taking the experts to evaluate the AI generated answers. It was basically as long, if not longer, than it was for them to actually do the legal research on their own, which is really interesting because if you think about it, these tools are supposed to save time for the experts, but if they want to do rigorous work and verify everything that comes out of the system, as long as systems still hallucinate, then these tools might currently not be saving them time. And if they don't do that hard work of verifying everything, then their quality of the work might be compromised. So moving forward, there's different directions. One of them is the evaluation direction. So we recently had a position paper. This is currently under review. It's not on archive because archive doesn't allow for position papers right now, but happy to share it individually if someone's interested. So we argue that the evaluation of legal RAG systems should be a lot more systematic than it currently is today. So right now, the focus is mostly on, first of all, whether the cited case laws exist. So it's not a hallucinated case. And then second, whether they support the claim that they're cited for. And these are very important, but there's other things that we need to be looking at, like whether the cited case is from a legal authority versus some kind of like minority opinion, whether it's from like a relevant jurisdiction, whether it's up to date. And then for the queries, like if they involve false presuppositions, then the system doesn't engage with the user and like justifies them as, LLMs tend to do, but rather corrects the wrong legal assumption. And if not enough information is provided to answer accurately, then the system should either abstain or look for additional information. And I'm going to talk about that as well. So this complicates evaluation even further, but I think it's very important. Evaluation is a bottleneck, definitely, for making progress in legal AI. And in terms of like modeling, in terms of the way forward to reduce hallucinations, so I think that hallucinations are inherent to LLMs. I think that because LLMs generate the statistically most likely next word, it's not necessarily guaranteed that it's factually correct or even faithful to the source. And hallucinations are actually a feature rather than a bug in LLMs because we want them to be able to generalize beyond their training data, the web data, and answer questions that require drawing on multiple sources and then synthesizing these connections. But when we do that, we actually risk these like incorrect generalizations. And current approaches for that address hallucinations, they only reduce rather than preventing hallucinations. And they typically do this by adding some post hoc verification step, like fact checking against sources, which adds computational cost and still doesn't work 100%. In our recent work, which I'll describe next, we focused on one factor that would contribute to hallucinations. It's definitely not the whole story, but when the user query is underspecified and the model is still answering confidently, but sometimes wrongly. So this is work called InfoGather. This is available on archive. It's another paper under review. And so in a typical RAG system, when you ask the question like, my flight was delayed and like, what should I do next? And the LLM responds with the long text. This is a very recent response from Gemini. It actually is correct for the best of my knowledge. It does include all these like different scenarios, like it depends on the reason for the delay. So whether it was like crew scheduling or maintenance, that would be within the airline's control, and then they have to compensate you. And it also depends on the delay length. So when did you, how late did you arrive in your final destination? So this is helpful, but this is not the best thing that we can do because arguably users don't like to read long text and they want the answer that fits their particular scenario, but they also don't know what specific information they need to provide in order to get that accurate answer, the precise answer. So what we do in InfoGather is we simulate the conversation that they would have with the domain expert. So maybe the expert will ask, how long was the delay? And then they say 5 hours. And then they would ask, what was the reason the airline provided for the delay? Maintenance. And then the conversation can continue until the expert can answer. And so to do this, InfoGather needs to identify uncertainty and then strategically generate questions that fill these knowledge gaps. And the way that we do that for this query is that the LLM consults an evidential network that we construct with an LLM from legal sources, like, for example, laws and regulations, about the possible answers and their probability. So in this example, the answers would be which regulation should be applied or like what should be the answer. So maybe they're not entitled to compensation, or maybe they're entitled to compensation based on the Canadian air passenger protection regulations, or maybe based on the European ones. That would depend on their destination. But there's some uncertainty here. You can see the probabilities are pretty equal at this point. So it's looking at the different factors in the network to reduce these reduces uncertainty. So that would depend on delay length, reason for delay, and origin airport. And at this point, asking about the delay length will reduce the uncertainty the most. So this is what we choose. And then we provide it back to the LLM and it generates an answer accordingly. So how long was the delay? And then when the user answers 5 hours, we provide it back to the network. We update the probabilities in the network. And you can see that after this, we significantly reduce the probability of not entitled to compensation because this is a long delay. It's not zero because it could still be like outside of the airline's control, but it's reduced. And this process repeats iteratively until the system is certain enough or a maximum number of questions have been asked. So we didn't really test it on the air passenger rights application because, as I mentioned earlier, we don't have data for that. So for now, we tested it on like existing benchmarks. In the legal domain, we tested it on bar exam QA, which is a benchmark for legal question answering. We also tested it in the medical domain on questions. It actually works very similarly with like different data sources. And we compared our method against a range of baselines that are based on LLMs and asking follow-up questions. Generally speaking, our InfoGatherer performed best in terms of success rate. These are the portion of conversation where the correct answer was predicted. It was the most turn efficient apart from the zero shot baseline, which it's an LLM that either asks a question or predicts the answer. And this baseline performs really badly in terms of success rate because it commits to the answer too early. And these are the results for GPT-5 Nano. We also have the results for QN3 in the paper, and they look very similar. Okay, so so far the makes it impossible to know what's true aspect of the talk focused on hallucinations. But I want to briefly discuss another aspect of this, which is that generative AI can be used to manipulate or fake evidence that is submitted to court. And this is what our CFAR AI safety network focuses on. It is led by Ibrahim Bagheri and Maura Grossman, and involves all the people on this slide and many great postdoc and students that are not on the slide. It is increasingly hard for people to identify whether content is AI generated or not. Like, for example, which of these receipts has been edited with AI? Honestly, I don't remember which one was, but because they look so similar to me, you may not even notice the difference. The transaction date has been edited on one of these. This is what the network co-directors say. So somebody can go to jail or not go to jail because the video of them is true or fake. So the stakes are very high here. And our goal is to design a framework in which humans interact with AI to identify potentially problematic content that is presented to the justice system. So we started working on this in January, so this is pretty new. But so far, we identified gaps in the existing data sets for AI detection. So a lot of these, there's a lot of work in AI, detecting AI-generated content. A lot of this is oriented towards like more general purpose misinformation detection. So like, just like synthetic or like generated text or generated images, but, general purpose. And if you look in the legal context, then the evidence benchmarks, they mostly focus on pre-AI era forgery techniques that are a lot more complex and not representative of the tools that we all have access to today, because we can very easily fake evidence these days with generative AI. And so we started collecting actually two data sets. This is the description of one of them. I'll mention the other one. So the first one is for images, and we designed it to evaluate image authentication under the conditions that legal institutions actually face. So half of the network are legal experts, the other half is computer scientists, and we have parallel tracks. So the legal experts are actually talking to judges and figuring out what's happening already in the courts, and then they inform us. So for the image data set, we have real examples from public source data sets that include things that people typically submit to the court, like surveillance cameras, dash cam, phone snapshots, and so on. And we created manipulated examples using existing generative AI tools. And the manipulations range from things like altering the scene conditions, like, for example, changing the weather or the time of day on images, through more substantial changes like inserting or removing specific elements like people, vehicles, and signage, through to complete fabrication of synthetic imagery. And we are benchmarking existing AI detection tools on that. And the other data set that we're collecting right now, very similar, parallel to that, is a document data set. There actually is almost no work on document manipulation, but that's very common in evidence. So again, we have documents like emails, receipts, clinical notes, and so on, from public source data sets. And then we have manipulated examples where we change one field, like in the example that I showed you with the receipt, or add like text, like a clause in a contract, and so on. Yeah, so that's pretty much it. Thank you, and I'm happy to take questions.
Thank you, Dr. Shwartz, for that fascinating presentation. We'll now open the floor for questions. As before, please submit your questions using the Q&A or the chat feature, or raise your hand if you'd like to ask question live. Question from Sandir.
Hi, Verita. As usual, wonderful to listen to you talk. So enjoyed it. Thank you. Great
Thank you.
presentation. I have 4 questions for you. And I can go in sequence so you don't have. The first one is, as you went from your chatbot to agentic AI, so did you actually then have done this whole thing in your own crafted agent framework? Because the open source framework have a strong notion such as a tool and context. And so you gone from attention all you need to context all you need to tools all you need these days. And so I was wondering how you architected the execution in your agent, accessing different sources, whether then implemented as tools or agent to agent, or if you can talk about that, the first question.
Yeah, sure. So I think that the most relevant work would be InfoGather, because that would be like an LLM that's combined with the evidential network. So that would be similar. I wasn't like, we don't really like treat this as an agentic AI, but it is in a way, because it is using this like external tool. So that was the first step of the process, but I think there's a lot more to do there. I think that so I think that one way, one direction that I'm really fascinated about, I don't know how to, like, it, we haven't done anything in that direction yet, is to treat written laws and regulation kind of like a code. There's a lot of similarity. It is in natural language, but there's also a lot of similarity to code, because it's often like kind of like describing like if-then statements. If we could convert this to something that's like executable and verifiable, that could really reduce, if not completely solve, the hallucination problem in terms of like answering legal questions. I think that would be a really interesting direction. But in terms of just using like existing agentic tools, we haven't tried it yet. I think we'll definitely want to benchmark more tools on our legal RAG benchmark. We just finished it like a couple of weeks ago, so we haven't had the chance to do that yet. But we want to know also how well existing legal research tools do on that. So I think we have a lot more to test.
Okay. Second question is related to removal of personal information. You have a tool sits in between that takes from these prompts and removes the personal information before it goes to Gemini.
Yeah, so that's an excellent question. So far, as I mentioned, like we didn't deploy anything yet, and we only tested it on generated queries based on publicly available data. But absolutely, like when we want to deploy this into an existing tool, like for example, as I mentioned, we worked with Caseway on this project. So if we come up with some ways to mitigate hallucinations that would be relevant for them, and they deploy it on their end, yeah, I think that it would be very important to use local LLMs and not send this to a third party. And yeah, in general, like deploy anything that you deploy that would use users' real data and personal information should ideally first run locally on an LLM, and then yeah, you might in some cases also have to go through anonymization.
Okay, quick third question. Do you see specialization for patent attorneys, real estate attorneys, and separate things orchestrated and they all live together? Or do you see one giant, humongous lawyer sitting in the back that knows every case law?
I think at this point it still requires specific expertise. I actually think that I mean I would like to study that, I don't know, but from the initial findings that we had from our benchmark, it seems like you actually need to be a real like expert to know whether something is whether the answer to verify the AI generated answer. It's sometimes actually really tricky because the errors could be really subtle, or it can look like it's supported by the documents that they retrieve, but maybe there's something in the document that it doesn't quite fit the specific context. So I think at this point we cannot give up on expertise. But at the same time, I would say like for the experts that annotated our data set, they were law students and paralegals, so they didn't have any like specific expertise at this point. So we actually instructed them that if a query is too hard for them and they think they don't have the expertise to answer it, they should just skip it. And so they skipped all the tax questions. So I can say at least about tax law that it's probably very different from other areas of the law.
Okay, last quick question. I won't take up too much of everybody else's time then. Did you play with AI evaluating AI rather than human evaluating AI?
Yeah. So our automatic metrics for the benchmark are based on AI, but where so it's not okay. So it's not an LLM as a judge in the way that a lot of other papers do, which is like the model just has to based on its own knowledge just evaluate the correctness of the answer, but it's rather like providing the source, which is either the expert's answer or the documents. It just verifies whether it's supported by that source, which is something that I'm willing to trust the model for. I think that just using the LLM and say, oh, can you tell me if it's correct or hallucinated, without giving it the source, I would be less willing to trust it because I think it's very similar to the task itself that we're trying to do. It's like a circular problem. If it's good at generating the answer, and we trust it that it doesn't hallucinate, then it would also be good at, I mean, it's not quite the same like generating and verifying, but it's very similar. You need to have the same like reasoning abilities and maybe like knowledge. So I'm a little bit careful with these like AI based evaluations, but I'm willing to use that if it's like based on just comparing to an expert answer. But even with that, we still saw that it sometimes overly penalized the systems actually for generating something that's correct, but wasn't initially captured by the experts.
A subtle variation would be Gemini critiquing ChatGPT, critiquing Anthropic, critiquing back, and then comparison as to whose critique was the best, I guess.
Yeah, I think that often when we do use LLM as a judge, we use multiple models and we show that they correlate, they either correlate to each other or like it helps us choose the best one. And we often also show that it correlates with people. But most of my experience was doing that on tasks that are something that is easy for people to answer and you don't need specific expertise. It would be interesting to test this for law as well. But again, I feel like there's a circular problem here.
Thank you.
Thanks.
Are there any other questions? If there's no other questions, maybe we'll wrap up today's session. Thank you, Dr. Abolmaesumi and Dr. Shwartz for the excellent talks. Thank you all for joining us today for the Researcher Spotlight session and for being part of the 2026 ARC Summer School. We hope the talks spark some ideas for your own work and collaboration. On behalf of the ARC team, We look forward to seeing you again in future events, maybe next year at the 2027 ARC Summer School. If you're interested in further trainings or support, feel free to reach out to us. We're always here to help. Thank you and have a great rest of your day. Bye-bye, everybody.
Thank you so much.
Thank you.
Bye. Bye-bye.